Hello, hello.
Welcome to the session.
Yes.
I am still figuring out things, so give me a minute here. Come on, little computer, you can do it. There you go. All right, I'm just gonna test the PowerPoint here, so we should see. No, not yet. Hold on one second.
Okay, no worries. Because I was like, nope, I don't see anything.
Okay. Now you should see the title page. Great. Awesome. So Lindsay asked if I want people to share their video. I'm not sure exactly how that's going to look on my end. I think I'm going to get, let me do this. I have three monitors running right now. Oh yeah. All right. So people, I think, can share their video if they want to, especially when they ask a question, because I can actually see the participants, which took 2 hours to figure out last night how to make this all work, but I'm doing it. So I can actually see people. So that would be my preference, I guess, is
Yeah, and then we'll just stay muted while you're talking.
yeah, that sounds good. So while we're waiting for people to trickle in, Sean, tell me a little bit about yourself.
Yeah, so I'm one of the organizers for Jersey Pride. I've been doing that for the past couple years now. But I've transplanted myself to New Haven, Connecticut, so I'm in New Haven now. But Jersey Pride will always be my home pride.
Okay.
But
Awesome.
yeah. Uh, let's see what else. I'm 27 years old. I identify as he, him, and yeah. Alan.
Yeah, glad to have you with us. Hi, Alan. Welcome. So, Alan, the way that we're going to do this is we're going to have people share their video if they want to, because I can actually see y'all kind of on a second screen. So we'll do that, and then you can wave at me if you want to ask a question, or just pop your mic on and stop me, because that's what I'm gonna want a lot of questions. Not that I want a lot of questions, but the presentation is very open to questions. Also, hi, Lindsay. So, Lindsay, how long should we wait for people to come in? Are we expecting more?
I think you're probably pretty good to start if you'd like to. I mean, we're 5 minutes past, so.
Okay. All right. And it is 1 hour, right? It's 3:15 is when the session ends.
Correct.
Okay, cool. Okay, so a little bit about me. I like to kind of talk about where I come from and my worldview. I think that's always like a really important part of doing any kind of training and education so that y'all know where I'm personally coming from and, you know, how I'm delivering this information. So about me personally, I am intersex. I was assigned male at birth, but transitioned when I was about 24. And I identify as an intersex woman, and I'll talk a little bit more about the complexity of that identity a little bit later. I'm also lesbian, queer, feminist, a pagan witch, bioqueer, kinky, and polyamorous. I'm also a huge nerd. I love gardening and science and video games. Professionally, I kind of started in the world of research and prevention in my undergraduate studies. And then as I transitioned to grad school and was training to become a licensed marriage and family therapist, I moved away from sort of activism and prevention in the queer world and sexual assault prevention world into a clinical role. And I've been in that for the last 7 years. I have a private practice in Wethersfield, Connecticut, and I work with about half my caseload is trans folks and their families, you know, helping people to transition kind of from coming in and questioning all the way through, you know, the surgical process. And as part of that work, I also do advocacy in schools and workplaces. So I will go into school systems all over Connecticut where my clients are and advocate for trans youth and their needs. And then I also do a lot of trainings and education for LGBT organizations. I do trainings for therapists, medical clinics. And then in my clinical work, I do, you know, the sort of typical clinical depression, anxiety stuff. I focus mostly on, or I'm most specialized in PTSD treatment and working with gender and sexual minorities, which includes poly and kink folks. So my theoretical orientation, I draw a lot from post-structuralism and postmodernism, queer theory, but I also draw a lot from my clinical training in marriage and family therapy. And we have somewhat of a unique worldview, which is something I'm very proud of. We draw from systems theory and ecosystemic theory, which means that we're trained to identify self-reinforcing cycles among relational groups like families, couples, polysystems, and all the way up broadly to even communities as well. So we identify, interrupt, and transform harmful cycles, for example, intergenerational family trauma. So you see like a trauma pattern that goes from one generation to the next. We have this really cool ability to see those things and interrupt them in a way that really no other field is trained to do. So currently my big large scale project is consulting with a large interdisciplinary clinic in Stamford, Connecticut. They're launching a trans care program for trans youth. They're providing wraparound care, so they're doing things like therapy, family therapy, case management, and endocrine care all at the same time, which is pretty awesome. So I'm really happy to be a part of that. So having said all this, I'm also not an expert. I don't try to claim that title. And I'm also definitely not necessarily like an expert in the area of intersex. I'm sort of relatively young in my journey of understanding intersex and understanding myself through that lens. So I'll also say that I'm not a very like shamey presenter. I know sometimes in like our social justice world, people kind of have a tendency to get really like intense and call people out. But I'm not that kind of person, so I would definitely encourage you all to ask questions. You know, there's no bad questions in here, kind of vibe. So the purpose of today is to learn about intersex people and the massive diversity of intersex lives and lived experiences. And what we're going to do along the way is deconstruct the concept of biological sex, which a lot of people are kind of like, oh, well, we have gender expression and that's great. There's like a lot of diversity there. And then, you know, there's like, oh, gender identity. Oh, we've got all these gender identities and it's all so diverse and whatever. But we kind of, in a variety of different settings, both within our community and a lot of times in the broader culture, are kind of like, okay, but the MF box of sex is like the safe space. Like that's just like, it's simple and binary and we like that. But as intersex, the existence of intersex people shows that that's really not true. And so we're gonna tackle that binary first today. Okay, so deconstructing sex, not the sexy kind. Okay, so so what I want to do first is really pull apart some different concepts here. I really like this model. It's something I learned about in grad school, and then I added my own layer here. So these are kind of layers of different identities and things that we need to pull apart in order to understand all the complexity of queer lives. So the first layer is gender expression, right? So this is like the way you express your gender or other identities. And it's separate from gender identity, right? So we can pull those two things apart. So for example, queer women might identify along the spectrum of like butch, femme. People might identify as androgynous or masculine or feminine, but that's not tied to their gender identity or any other of these items that we're going to talk about. So then we have gender identity, right? And so this is kind of like this internal sense of like, this is who I am. And then that can combine with gender expression in some interesting ways. And then obviously people can identify with agender and don't identify on any spectrums at all. So then we have, I'm going to skip to physical body. So down at the bottom, we have male, female, and everything in between. And these are our physical bodies, right? And that does not need to be tied to gender identity or gender expression, right? Like just because someone has certain body parts does not determine their gender identity or their expression. And the area that we're going to be sitting in today is this middle part you're seeing down at the bottom in the center, where we have intersex bodies and we also have non-binary bodies. So the difference there is that, and this will become more clear as it goes on, but so non-binary bodies are folks who are whose bodies are non-binary as a function sort of after birth, and we're going to talk more about that. But their difference in the way that their body sits between male and female is not a function of a medical condition, whereas folks who are intersex are sort of are coming from or have bodies between male and female, coming from a physical and medical difference that is not acquired post-congenitally. And then we have something, this is my addition to this diagram, which I'm very proud of. And if you use this language, I would love to be credited. So I have developed this concept of body identity. And this is something that's separate from physical body, right? So this is the way that people see their bodies in their heads. which is separate from gender identity, it's separate from gender expression, and it's separate from the physical body as well. And so, like when I work with my trans clients, we talk about what is your physical body now, and what's the difference between that and the body that you see in your mind, right? And so what's the body in the mind is the body identity, which again is separate from gender identity and expression. So for example, you might have, so I'll explain bioqueer, which is something that's in the middle. So this is one of my identities. This is my body identity. So the body that I see in my head is non-binary in the sense that it's fully feminized, but sometimes has a penis and sometimes has a vagina, and it fluctuates, and it's sort of this fluidity between different body parts that are male and female, and that just fluctuates and changes in the same way that like some folks have a non-binary gender identity where they're fluctuating between male and female. And so my body identity fluctuates. And so I came up with the word bioqueer to describe my non-binary gender identity, or non-binary body identity. There we go. So as you can see, we're really pulling all these concepts apart, and that's important because when we talk about intersex and the complexity of bodies and queer embodiment, we really have to like, this is the best model I've found to really capture all of the complexity, that I can map myself onto this diagram in a way that explains like 98% of all of the factors of my queerness. And that's something I really, really like about this model. So I want to stop and pause and see if people have questions about this or reactions. What do you all think about this diagram? So feel free to just jump in.
I think it's super interesting, that you came up with body identity and body queer. And I was just noticing that like the fact that gender expression has so many more kind of like descriptive words on it, because it's been like a longer understanding of things, and that there's less, as you know, with the other categories. But the question that I have, I suppose, would be the difference between, and more description between, if there's a difference between intersex body and physical body or a non-binary body. You're kind of explaining the difference of that.
Yeah, so that's a good question, and that's a space that is very new kind of to understanding. So so for example, so the difference between me and a trans woman who has a non-binary, a body outside the binary, right? So a trans woman might say, okay, I have a body that is, I identify as a woman, I express femininity, my body identity, the map I see in my head is a female body with a penis, right? And so that's technically in the non-binary zone. Of that body identity falls between what we typically consider female versus male. And then the body itself, if the hormone and transition process hits that point where that's the physical body, that person also has a body beyond the binary, right? We would say that they have a queer body that isn't strictly in one of these two boxes, but they're not intersex because their body has gotten there through, you know, hormone or surgical intervention, whereas my intersex body has a mix of body parts based on a medical condition, and the way that I was born, and that my body parts are arranged comes from something my body did to itself. Maybe that's the best way to put it. Does that help answer that question? Okay, cool.
But
other questions on this? Oh, go ahead, Alan.
Maybe not so much a question, but an observation is the way you have the line set up as an arc. It kind of makes me think that this is a meter, you know, and that you don't fall, not you, but the person can be anywhere, like almost like a spectrum. You know what I mean? You could be on one
Oh
side
yeah.
or the other or in the middle, and each person is different. You could almost like put a zero in the center where you're like a little bit of everything. And if you move to the right or the left, your numbers get higher or lower. You know what I mean? So it just reminds me of, like, I work with children who have autism, and they're on the spectrum, and depending on where they fit, you know what I mean? So this is what it reminds me of, that not everybody's the same. Everybody's different. Everybody falls differently on how they self-identify or what their actual situation is, whether they're born that way or they choose to have a body that way. You know what I mean? So that's what I kind of like about your chart, that it's not specific. You can place yourself on there wherever you identify.
Yeah, yeah, absolutely. Sean?
So to kind of piggyback what Alan was saying, was I see the meter, I see what he means by that, but I also I viewed it actually almost as an onion, because the top layer is kind of like what the world sees you as, like passing by, passing by someone on, like, down the street, they might notice that I'm, portray myself as, more of a, maybe a masculine, male that's walking by, but that's all they see. But then if I stick on like a pair of high heels and, have my hair nicely done and maybe paint my nails or something, they might say, oh, well, he's more feminine. And then, maybe if they come up to me and they talk to me more, okay, hey, my name's Sean. My pronouns are he, him. Okay, that's his gender identity. Like, so as they get to know you and they kind of peel back those layers, that's kind of how I saw the chart. Because all the way up until you get to know me more, then you might say, okay, well, yep, his physical body, he identifies as male, but his also, his gender and his body identifies as male as well. So then, so it's kind of like that, peeling back the onion kind of depiction. But that's how I viewed it.
Yeah, actually, you both picked up on something that I didn't even go into in my description, but you're both perfectly accurate on both of those observations. Yep. All right, I'll take one more question if there is one before we move on. Okay, all right, sounds good. Okay, so another big diagram coming up here. Okay, hopefully you can see this. I know the text is small, but these are, I just love this diagram so much because it shows even, that we had those 4 layers and we had intersex bodies right down in that one little corner. So we're now going to take that and blow it up and talk about everyone who's in between male and female boxes. So each one of these is another slider, right? And so these are all the ways that someone's body can be between the binary. So we have sex chromosomes on top. There's like, I think 7 or 8 examples up there of the different types of chromosome configurations that people can have that are sex chromosomes, and all those people who are different types of sex chromosomes have different phenotypic presentations in terms of how they look and how their bodies are and the different ways that they're in between or have less sex characteristics. Then we have genes on the chromosomes. So there's all these different DNA sequences and repeats and mutations and deletions that all create their own sort of fractaled out implications for body. We'll talk about some of that later. And then we have differences in which people can have differences in terms of their gonads. So some people, for example, literally have ovotestes, which is a word that describes gonads that are actually combined and sometimes have different streaks of the different tissues within the gonad. And then you can have no gonads, you can have this mix, you can have 1 ovary, 1 testy, you can have both. I actually knew an intersex person who had both fully functioning testes and fully functioning ovaries. And then we have external genitalia. So this is where a lot of sort of the primitive understanding of intersex came from, because when an infant is born with an outside physical difference, it becomes quite apparent at birth. So this is where you have a clitoris that is large enough to be considered a penis or a micropenis. You have undescended testes. You have genitals that are sort of in this blended state between different external genitalia traits. And that's where the original focus on intersex was, because that was the most immediately apparent difference that people could see. Then you have internal sex organs. There's a list there, like the prostate, seminal glands, different ducts. And those can also be cervix. Those can also be, mixed and matched. You can have any combination. Then you have hormone levels, right? So where you have androgens on the left, that's testosterone, DHT, and then estrogen, progestins on the other side, and you can have any combination of those that create different phenotypes. And then, of course, we have secondary sex characteristics like breasts, body hair, etc., and those can all be in all different sorts of combinations. So intersex people are people whose bodies are anywhere outside the binary on any of these spectrums. And what we know is that about 2% of people are somewhere on one of these sliders or more, and it's actually quite common. It's, the human body does this very intricate dance in terms of biological sex development in utero, post utero. There's all these different organs that actually travel across the embryonic surface and do all these really wild things. And it takes this very, very intricate dance to make sex organs the way that they are considered in one binary or the other. And so if queer means against the dominant narrative or increasing complexity, then we intersex people and our bodies, queer bodies and queer, the categories of sex. We are literally the embodiment of queer, if you will. So I'm going to take a minute to make a note here that you may have heard the word hermaphrodite. That is an outdated word for intersex people. And we are going to talk about another word in a minute called disorder of sex development. But throughout this presentation, I'm going to use the word intersex. So questions and reactions to this diagram? Yes, Hope.
Thank you. Just looking at this and reading, they are not necessarily on this spectrum. Each line is not necessarily mutually exclusive, correct? Are some, like, sex chromosomes, depending on where they sit in the scale, would then influence internal sex organs or influence external genitalia? They're not mutually exclusive, correct? And rather, some
absolutely
influence others. The rudimentary biological education that I have.
Yeah, yep, you're absolutely right.
Okay.
They can kind of cascade into each other for sure.
Okay, thank you.
Yeah. Yes, Edwin.
I got a question about it kind of goes back to the beginning when you used the phrase bioqueer. Is there any kind of technical term for that? Like, it's not on the scale when it comes to the brain, I guess.
Yeah, so bioqueer being an identity, it doesn't map onto any of these physical categories. It's that kind of like psychological component that's sort of mutually influencing with this, with what's here. Yeah.
Okay.
Good question. All right, anything else before we move on? Okay. Okay, so we're going to make some distinctions as we continue to talk about these different words. especially as this is sort of an intersex primer, and so these are like important words to learn if you're gonna be anywhere in this sector of queerness. So I think it was maybe somewhere between 5 and 10 years ago, the medical community changed their terminology from intersex to disorder of sex development. And what disorder of sex development specifically means is it's a list of medical diagnoses with a medical code and a list of criteria, and but it's also sort of a reframe of intersex as a community or identity tied to body that they've sort of drained that out of it and made it sort of medicalized. So some people identify with one label, some identify with both. Some people don't see either intersex or DSD as an identity itself. So I identify as intersex, that's part of who I am internally. But some people see it as a condition of their life, as they might see sort of any other sort of chronic medical condition. They might be like, this is something that affects me, but it is not me, and it is not a community membership. So people can go either way on that. And then picking one label or another, as I've kind of come to see it, really tends to be a sort of correlated to the person's story about their body and their worldview. So, for example, someone who identifies with DSD only might be more invested in their body through a medical lens. Or they might be invested in a story in which this is something that is happening to them. Some people may see their disorder of sex development like a congenital illness. And when we talk about stories and meaning of intersex, DSD, and identity, the meaning is important. And so for some people, being intersex is a terrible curse. It's painful and involves a lot of letdown and sadness and feelings of negative difference and stigma. And so for some people, it can be a really pervasively negative experience. And so, that can be part of the story as well. And someone might story that as DSD versus intersex or neither. Yeah, and then there's some people on the other side who really are sort of staunch intersex folks who really like that term a lot better and really don't like the medical community kind of taking the word from them. And so there's a lot of complexity here. And so there's some overlap and there's some difference. So another thing we need to make a distinction about is LGBT or queer and intersex and DSD. So some people who are intersex, like myself, identify as queer or as part of the community. Part of that is I also identify as a lesbian and like queer and all these other things. So I'm very comfortable in the LGBTQ space. But some people in the LGBT community do not consider intersex to be part of the community, and some people who are intersex do not consider themselves part of the LGBT community. And so you will see probably if you've got a bunch of intersex people and you have them in a room talking about this, this would be a heated debate. So again, it's up to the person and the meanings that they make, and the story of their bodies and the story of their identities. So any questions about those two diagrams before we move on? I'll take maybe one question before yeah, Sean.
Do you find like for you, like for not for you, but just in your practice, like do you find that a generational difference between like people that prefer the term intersex versus what was the other one, development,
Disorder of sex
Yeah,
development.
development. Yeah, disorder of sex development.
Yeah, it's because DST is a little bit of an older or a newer term. Sometimes you see a little bit more of that, but I think overall, I think it's still pretty split down the middle.
Okay. No, I was just curious.
Yeah, good question. And then Pierce asked, "Do you have an opinion about the I in LGBTQIA?" I personally like the inclusion. I think there's a lot about intersex that I think fits with the LGBT community. I think that I would describe intersex as a gender and sexual minority because we're in that zone, and I think particularly when we talk about like transness, we are also sort of invariably talking about bodies beyond the binary as well. But I also respect people who are like, nah, you're not my people, in terms of like, I just have this condition, which means that I'm sterile. So then I'm like a straight cishet person. So I don't know why I would hang out with you guys. Okay, we're gonna move on. Okay, so really part of my mission today is to capture some of the diversity of intersex folks, which we've already gotten into. But yeah, intersex is massively diverse. It's a huge umbrella covering, upwards of 100 different medical diagnoses. It's about 2% of the population. And we're going to look into some lived experiences and a little bit of like comparing, contrasting different cultures and their experiences of intersex. I think I'm going to save one of these videos until the end because it's 15 minutes long and I don't know if we're going to make it through the whole thing. But it's actually pretty critical. Okay, so what I want everyone to do for simplicity's sake is I'm going to have you go down below where you're seeing my presentation into the description, and you're going to see an embedded YouTube video. And I think we all have to click play and watch this separately. I don't think if I click it, it's going to start playing in your window. So I want us to all go down to that. And you should see Emily Quinn, What I've Learned from Having Balls. And I want you all to start that, and then I will check in with you at some point throughout the video. I might have you watch the whole thing. I might only have you watch 5 or 10 minutes, so we'll see. All right, so go ahead and start that up, and then we'll talk after. Can y'all hear that? Hear the
Yes,
testicles.
the video? Yes? Okay, great. I can't, but I'm glad you can. Okay, so in the interest of time, I'm gonna bring us back. So hopefully got through most of the video. Okay, so thoughts and reactions really quick on Emily and Emily's story.
I don't know. It was a really powerful story. So I didn't really know that much about this, and it was interesting to hear her talk about the amount of people that showed up for like I don't know if it was a convention or not, but she said there was like a lot of people at that area, and
yeah, she has a very compelling story. That's why I wanted to share it. I was like, she says it better than probably I could ever explain it.
yeah, can only imagine. It's very different, and then coming out on MTV publicly, like
Mm-hmm. She's brave, brave lady.
thank you. I appreciate both of you for coming out and letting me know. I don't think I know anybody that is intersex or have had the conversation.
I'm glad it's helpful. Yeah, it's good to come out of the shadows. Anyone else before we move on? No? Okay. All right, so next we are going to, come on. Okay. So we're going to shift gears from Emily's story and draw a pretty big contrast. So there is a population, third gender population, or third sex population in the Dominican Republic called the Guevodosis. And they are folks who appear 100% phenotypically as female girls and no difference in terms of their genitals when they're born. And then when they start puberty, they fully masculinize 100% and fully develop male phenotype. 100% are completely fertile. There's literally no difference between them and their female peers when they're born, and then there's no difference between them and their male peers once they have gone through puberty, which is quite different than a lot of intersex conditions where there's some level of medical impairment. So it comes from a genetic deficiency called 5-alpha reductase deficiency, which prevents DHT from becoming testosterone in the body. And so what happens is in utero, they don't get exposure to this chemical, and their genital tracts do not masculinize. But then testosterone gets secreted at puberty outside of the DHT pathway. And for the most part, it's fairly common. So 1 in 90 births. So a lot of people are aware of this, and there is much less stigma and almost no medicalization of this process, and it's sort of culturally talked about and less invisible, much less invisible. So a quote from a mother of a Guevodosis person is, "When she turned 5, I noticed that whenever she saw one of her male friends, she wanted to fight with him. Her muscles and chest began growing. You could see she was going to be a boy. I love her however she is, girl or boy, it makes no difference." Okay, so then we'll talk about persistent Mullerian duct syndrome. And even within this one diagnosis, we're going to talk about intense diversity. So for me, so first of all, persistent Mullerian duct syndrome is where in utero, there's not, you have both the beginnings of both genital tracts. And then when testosterone gets secreted in utero by your body, the female Mullerian structures that would become uterus, ovaries, fallopian tubes, etc. They dissolve, and then the male genitalia develop, sex organs. So what happened for me is I got the male sex organs, and then I also got some of the female sex organs as well. So I have a uterus, and it basically was just chilling out in my body since birth until I figured out what was going on. There might be some type of other differences, but that's kind of what I know so far. So it started with very like shadowy confusion, and this is something that you'll hear talked about a lot in intersex stories, is like there was always this weird stuff going on. You know, like I had a lot of like pelvic pain, urinary pain growing up. I didn't really know why. I was very confused by it. I went to a urologist at one point, and it was sort of written off as like a developmental was the only word that was used. And they were like, "You're fine. You know, we don't need to talk about this." So there was like this, something's different. I found out over time that both my siblings are intersex as well. And so there was kind of like this like sort of familial, like, oh yeah, there's, you know, the men of the family have like wider hips, and, you know, there's all these differences in the way our genitals look and are from what we expected. And then I transitioned when I was 24. And so that, you know, sort of was always seen as separate. I didn't really, you know, connect all this stuff that had been going on with that, because I had really no reason to, in terms of like, I'd not been trained to make those distinctions. Then I had to fight a lot for the diagnosis, because I started noticing that something was different. I noticed I was having a period, and I also realized that I'd been having a period since I was 18. So I started to like put all these things together, and the way I went through HRT was very different than the typical like MTF transition. I'll keep this short because we're running out of time, but then there was a shift in gender identity, or not gender identity, shift in identity. So I used to identify as a trans woman, and then now I identify as an intersex woman. There's a lot of complexity there I don't have a lot of time to get into, but it basically really reorganized how I conceptualize myself. And for me, it's mostly been this like positive process. I think based on where I am, already being queer, like I'm very comfortable with all this. And then I want to contrast myself with Rob, who was, there was an article about him. That's a like confidential name. So he's a man who lived in the UK, has the same condition as me, although he had a much more developed set of female organs. Mine are sort of like very small and underdeveloped. He's just another dude by his like kind of like the quotes that he gave in the article. He identifies as a straight cis man, does not identify with intersex or the LGBT community. He basically saw the discovery of his uterus as a passing inconvenience, and had a hysterectomy and like went on with his life. So in the article, he's quoted as, "The diagnosis came as a bombshell. I've never seen myself as anything other than an ordinary bloke who has a normal sex life. It appears I could even potentially get pregnant. I hope any man with similar symptoms will get checked out." So as you can see, wildly different experiences and life trajectories between the two of us. So I want to just, so one thing, intersex genital mutilation. So one of the things that you will consistently see in a lot of intersex narratives is the medical, you know, Emily talked a little bit about this, but she honestly got off pretty easy. A lot of intersex kids are operated on without their consent when they're very young, if not even when they are literally infants and days old. The way that a lot of people approach this is they're like, well, being anywhere outside of the binary is bad. It makes you a freak. You're gonna have a bad life, and we have to correct that and give you one gender or another. And unfortunately, what that always results in is a sense of violation, later on in life. And the takeaway here is that doctors and parents, when they try to make that decision without the child, it always ends in tragedy. It's awful. It's really, really bad. And it still happens a lot. In Connecticut, the sort of leading authority on pediatric endocrinology, who works with a lot of trans kids, and who is kind of like the authority in this area. She actually wrote a position statement speaking out against a bill that would have completely banned intersex surgery on children. And so this is someone who is an authority in Connecticut and someone who treats children, and it makes me very scared. And if people want to stay on, I'll finish the presentation. There's probably 5-10 minutes left, but for the folks who are going to leave, I put 2 links in the session description below that video. There's 2 really good sources that I really recommend. One is the graphic novel ISU, or Intersex, or IS, and it's a really incredible compendium of different intersex people's lived experiences who live in Japan, and it's sort of short graphic novels that are serialized, and it shows a lot of the diversity. It shows a lot of really good perspectives from the family as well, like how families react to this stuff. Also a lot of what it's like to be in high school and in college with a variety of different conditions. So really recommend that. And then there's a book called Herculine Barbin, which is the literal memoirs, which is what I love about this book. It's literally the written memoirs of an intersex person from 19th century France. So you hear it from his mouth of what it was like to be an intersex person at that time. And the person who put this into book form and wrote an introduction and all that was Michael Foucault, who is really great and sort of famous in this area. So for those of you who need to move on, thank you so much for coming to this presentation, and I'm really glad that organizers of Pride events are learning and want to learn about intersex folks and all the complexity of our lives and our intersection with the community. So thank you, and if does anyone want to stay, I can talk a little bit more on this the intersex piece around surgeries and whatnot. Yeah. Okay. Cool. Awesome. All right. So getting into a little bit more of why these surgeries are so bad. So I want to talk. You have almost always encountered the tragedy of John Reimer, and what happened with him. So he was a child born with, I don't think it was quite an intersex condition, or would be considered to be, but they did operate on his genitals as a young child. I think he had an extended foreskin. Essentially, there was a circumcision that went wrong, and his genitals were basically destroyed in that process. And so the parents went to the leading gender expert at the time, which was this person, last name Money, at Johns Hopkins. And at the time, there was this idea of gender neutrality theory that gender is entirely nurture. It's not nature at all. And that, it's all a construct. And, and from that, people took away oh, well, then if we just, before the person has any nurture, we can just write the story of their gender and just socialize them that way, and then they'll feel fine about it, and it'll be great. And so, but of course, that didn't end up being the case. And as John, who was originally assigned Joan, grew older, he became aware of his male gender identity, even without knowing anything about the genital difference, and essentially was a trans man or having a trans man experience despite not technically even being a trans man. And the psychological impact on him is well documented by him and shared in the media. And he really spoke out against, this process of intersex genital surgery or any infant genital surgery. This was so negative, had such a negative impact on him that he ended up committing suicide. And what we need to take away from this study is that we have to understand that actually there is a nature component to gender, which we sometimes understand in our community as like we were born this way, right? And but we also have a conflicting narrative that like gender is entirely a social construct, and so obviously the dialectic is that both are true. There are different components for both. So we have to remember, and doctors and people in our community need to remember the arrogance of nurture, this arrogance that that gender is a specific way and it's not connected to body and it's not connected to nature. Then there's the arrogance of medicine and parents. So I am a student of bioethics, and the first principle of bioethics is autonomy, which means that people should have control over their bodies. And medicine has had a pretty bad run of this, even though they're sort of like supposed to be the paragons of bioethics. As marginalized people, we know that doctors try to take control over our bodies and limit our treatment options and tell us what to do in all kinds of ways, right? And this is true for women and queer people, fat people. There's so much, people of color. There's so many instances in which the dominant societal structures have reduced the autonomy of people who specifically who are marginalized and vulnerable. And so they violate their own principle of autonomy. And parents participate in this as well. Sometimes they're sort of like told to participate in this by doctors. They're like, the doctor will say like, no, you're going to damage your child. You need to, you're a bad parent if you don't have this, do this surgery on your child right now. And this is particularly difficult postpartum because there's a lot going on and it can be very confusing and difficult to be hit with that decision in that place where, birthing parents are really vulnerable. And so the takeaway here is like, let intersex people decide what to do with their bodies, like hands down, like that is like the hard and fast rule. Reflecting on Emily's story, like that's a huge theme is that, there was a sense of violation. Doctors often have this like fascination or curiosity with intersex bodies, which is horrible and completely inappropriate. We're often treated like a weird case that like people want to check out. I read a qualitative study of intersex stories, and one person talked about this horrific experience where they went in for something completely unrelated. We can say it was like a broken arm or something like that, and was put in this room, and doctors from all over the hospital, including the medical residents, were invited to come down and examine them repeatedly throughout the day, completely against their consent, and just like horrific. Like that should just never, like when you go in for a broken arm, you should not be having genital exams all day. It's really, really, really messed up what people do to intersex folks. And so medical trauma is like one of the themes of intersex experiences. For myself, there's another component where the doctors just don't know anything. Like I went to the intersex specialist in Connecticut and he didn't know anything actually about intersex. He was like, did a karyotype, which is where they look at your chromosomes, and he was like, well, you have XY chromosomes, so like you're not intersex. And I was like, okay, but like the spectra of sex, like don't you like know that there's like another 100 things that could be different about my body. But he was also just an idiot. Generally speaking, he's this Dr. Honig, who, if you know surgeons in Connecticut, you know that he's a complete fuck up, as a general rule. So the future is, we really need to be providing doctors and families with education, and like really having them understand that the healthy thing is to let intersex kids grow up, understand their difference. You know, the doctor can be in a positive role around providing psychoeducation, and saying like, yeah, you're, as a doctor, I'm affirming your body is okay, it's normal, it's still valuable and wonderful. You know, this is not something bad about you. And then obviously families having that education as well, and bringing intersex out of the shadows so that people and kids don't have to like fear their bodies. And also that endosex people, so people who are not intersex, also know about these conditions, understand it's really common, you know, 2%, so it's 1 in 50 people, right? That when their friend says, or, you know, they're taking a shower after gym and their, you know, friend's body looks different, then they're like, oh yeah, that happens sometimes, that's totally fine. And really emphasize that like kids do not have to have bodies that conform to the sex binary. And also, you know, really making sure that kids feel like they have a decision, or that they have a say in their own body parts, and let them figure it out over time. Follow the child's lead. There's, in that ISU graphic novel series, there are some really incredible examples of how families stepped up and said, we're going to let this kid figure this out as we go on. We're going to talk to them about it and check in with them about how they feel, support them in how they want to present their gender, how they want to identify their gender, you know, changing. There's, I think, a couple stories of people who kind of shifted their, you know, they kind of wanted to be a girl, you know, I'd seen as a girl at school for a while and then seen as a boy later on. Another thing about intersex bodies is that they can really change, kind of like the Guevo dosis folks, like there can be a big shift at different times and different hormones come into play, and that can affect gender identity and expression. And intersex people are just like a wonderful and beautiful part of the human spectrum of diversity, in the physical sense. You know, nature is really about variation, right? And so intersex people, we're part of that variation and part of the beauty in which nature can present in different ways. So that's my presentation, and I would invite anyone to ask questions or have reactions or have a discussion.
I just want to thank you. I learned so much from this short presentation, and thank you. You made it easier. I have, you know, people who have identified themselves as intersex to me, and I thought I had an understanding, but thank you. I'm going to read both of those books. So thank you so much.
Awesome. No, thank you for being here.
That was great. I took 2 pages of notes.
Awesome. I love to hear that. When people take notes in my trainings or in my sessions, I'm always like, good.
I feel like I should know this. Did you say endosex? Like, is that like the cisgender equivalent of? I didn't know that. Is it ENDO?
Mm-hmm.
All right, thanks.
To be fair, I just learned that word recently, so I don't think it's like super like well
What was
used.
that? I'm sorry. I must have been writing notes at the time.
No, I said it very quickly. So it's endosex is the opposite of intersex. So it's when your endosex people fit one of the 2 binary sex categories. Oh, another book too that's really good is this In Between Bodies book. I don't know if you can see that.
Oh yeah.
Yeah, by so it's Sexual Difference, Race, and Sexuality, Mary Bloodsworth Lugo. It doesn't really actually tackle intersex very much, but it is a really good primer on when bodies are in between. And I pull a lot of my like sort of theoretical conceptualizations from that book too.
Yeah, listening.
Good. I'm glad, Pierce, that you found it illuminating. And that's really cool that you have a family member who's XXYY.
With your discussion about like doctors and medical treatment and medical trauma, and it just, these types of conversations have been coming up recently about like just doctors being really insensitive or outdated or just ridiculous in general. And I've had my own experiences just trying to talk casually as an advocate and then having some really ignorant responses. And I always like to think that doctors are body scientists, so they only know what they know until they know something else. So, but they don't always treat themselves that way. So.
Yeah, absolutely. I mean, trans medicine is bad enough as it is, and intersex medicine is probably 20 years behind. I mean, the fact that I couldn't find a specialist in the state, and there's like probably 6 or 7 endocrinologists doing semi-competent trans care is like, you know, it just shows how far behind everything is. For conditions that affect, you know, 1 in 50 people. That's crazy.
Yeah,
absolutely crazy.
Yeah. Well, it goes to show you how long, like the trying to put people in a binary and making those decisions on these victims, people, you know, that's just how long that's been going on. And then just to not to discuss it afterwards and assume that the problem you have now fixed the problem. So there's nothing to talk about, I guess. Anyway.
Yeah, no, I was actually really lucky to figure this out later in life, because if this had become apparent when I was young and I was in the really, shitty, bigoted household that I grew up in, my parents absolutely would have taken that autonomy away from me, and I would be right now feeling very violated and upset about that process, because I feel really proud of having the organs that I have, and I, have a good relationship with them, and like them, and like having them be a part of my body. And so and also too the complexity of, at that time I probably, because I grew up in a transphobic environment, wasn't identifying as a girl. I didn't really have a concept of that, and so I might have been like, I'm a boy with a uterus, therefore I should categorically remove it, without having any examination of that or having anyone be like, oh, well, what do you want your story to be of the fact that you have these organs? And let's explore that and sit with the complexity, right? Like, no one could do that in my life, and so I probably even would have opted into having that, and then feel so much regret now.
Are your siblings because you mentioned that you have siblings, like, are they as, I guess, open, or do they feel as good about their intersex identity as you do? Or, because I know you mentioned that. I don't want to ask you to divulge too much of their information, but.
No, it's okay. They actually, well, I haven't really talked to them in many years because I don't talk to my birth family at all. So, but when I talked about it, well, actually, with my brother, the way I found out was that my mom told me that my bio mother was telling me that he, like when I was maybe 7, she was like, oh, there's this thing going on with your brother and his, I forget what the word she used, but like, his privates are different, and like he needs a surgery to like make it better. So he might be in pain over the next couple of weeks because we're going to go do that. And he had something, I think, approximately hypospadias, which is where the urethra sort of comes out at a different point on the penis. And then there can be other implications as well. prior to my transition, a funny story was that actually right before I transitioned, so I thought it was especially funny. We were in my biomother's kitchen, just like kind of hanging out at a family thing, and he was like, you know, he's like a frat boy, so he's like, oh yeah, it's like, isn't it so weird, like how like you and I, like the men in this family, like have really wide hips, and like, and I was like, yeah, dude, like it's, yep, it's really just terrible, so bad. And I'm thinking in my head, like, thank goddess I have wider hips because I'm about to transition, but I didn't tell him that. So yeah, and then my sister mentioned it offhand once, and just mentioned that like there was something there that was different, and she kind of had some weird feelings about it, but I didn't press it, so I don't really know kind of what's going on. But
So it's just the knowledge of it. I mean, when you said it, I was like, wow, did you grow up in like an intersex affirming family? But then that's
I wish it would have been great, but yeah, but and yeah, so my siblings are very much like, you know, they're totally like identify with their birth gender, and I don't think would ever identify with intersex. I think they're just kind of like my sister, there's some issues with her like fertility, which I think play into it, and that is very upsetting for her, and difficult as it is for me as well. But yeah, they're kind of in that zone of like, oh, this is weird and we don't have a word for it, but they would never identify.
Gotcha. Thank you for sharing that.
word.
I mean, very personal information. So
yeah, no worries.
yeah, this has been an amazing session. There's been great.
Good. I'm glad you enjoyed it. And like I said, I'm thrilled that this was something that, you know, Lindsay, you prioritized to have here at this event, and also too that like Pride is making space for these conversations.
Yeah, at the request of the NERD members, you know, I did mention that there was a list of workshops that NERD members had specifically said that they wanted to see in Intersex. But was one of them. So I'm super grateful that you're here.
Oh, thanks.
Thanks so much.
All right. Take care, everyone. I gotta run.
Bye-bye.
Bye-bye.
Bye.